reporter, UCLA students are making a difference. I'm here in Maclovia Rojas, just outside of Tijuana, Mexico, where students with FISH, the Fellowship for International Service and Health, set up a clinic in a local market. In this central location, Bruins provide easy access for basic medical care to those in need. Let's take a closer look. The nonprofit organization was started 2 years ago by founder David Carrion, who explained his initial vision.
I wanted to have an organization that combined my faith, my belief in God, and my desire to serve others abroad. And I couldn't find anything like that, so I was led to start this, to connect the people who want to help with the people who need it.
Third-year Elizabeth Kilonoff described the typical process of a community member coming through the tent.
So they come up, they see our signs, our fabulous signs that we have around here, and the first thing they do is they get their blood pressure checked, and they get a paper, we write down their name, their age, and we take their blood pressure, find out what it is. They go to the next station, which is glucose testing for diabetes, and then they are asked if they need glasses, and we only give reading glasses, not reading glasses for nearsightedness. And then after they've gone through all the stations, we have somebody, usually whoever speaks the Spanish the best here, do like a counseling kind of thing with them and tell them they have high blood pressure, what they can do, like exercise, eat fruits and vegetables, and things like that.
This trip's designated Spanish speaker was first-year Kelly Burke.
I love it that I get to do like the consulting today, just to talk with them, to see how they're doing, how life is, like what we can do. But, giving them vitamins and hearing about this woman I just talked to has 5 kids, and just to interact with them and realize that they're people, they're down here. Life is hard here, and to kind of help what we can and kind of bring encouragement.
For some, the language barrier proved more difficult than for others, but it wasn't anything that couldn't be overcome with a little patience.
I'm not very good at Spanish, and I'd need Kelly's help pretty often, but I managed.
Students make trips every other weekend and have started to gain some regular patience as well as a familiarity within the community, partly based on their recognizable t-shirts. FISH associate Amanda Pease told us her favorite part of the trip.
My favorite part is definitely when I can talk to someone that's been here before, checked with either with FISH or elsewhere, that has had their numbers checked before, just asking them how they've been. There's been so many cases where people have had glucose readings even in the 300s, which is really high, and have come back and they said they changed their diet, they've been exercising more, they've been trying to live better, and their glucose readings are down to like 120, which is amazing, oftentimes over like a 6-month period.
However, FISH offers more than just medical aid. In addition to looking to expand their efforts to education in English and computer skills, students are also taking initiative to look into the environmental conditions of the area.
We're doing mercury testing of the water and of the food supply, the fish, trying to make sure that they're as healthy as possible in all the ways we can.
Looking to the future, FISH hopes to expand to other colleges and universities. On this trip, Caitlin Losey talked about UC San Diego's new FISH branch.
Planning on tagging along with UCLA for the beginning, see if we have any emerging leaders that can help arrange something separate so we can branch off and reach more areas. I'm really, really excited about this. I've had a great day today, and I think we've made a big difference.
Reporting from Maclovia Rojas, Mexico, for Daily Bruin TV News, I'm Lisa McBride.